So I'm fellowship trained glaucoma specialist Dr.Nandini Narayanan, practicing at Medcare Eye Center. So today I would like to talk about lasers that we use for treatment in glaucoma. There are many types of lasers available. One of them is used for treatment of angle closure glaucoma, whereas the other one is used for treatment of open angle glaucoma. The one which is used for treatment of open angle glaucoma is called as a Selective Laser Trabeculoplasty, also conventionally known as SLT. Now, there was a very important trial which was published in the year 2019 on the treatment of glaucoma, especially open angle glaucomas, with using lasers. And on the back of the results of this study, all over the world, there has been an increasing shift in adopting laser as a first line of management in treating glaucoma. So once anybody is diagnosed to have glaucoma, the conventional or the traditional form of treatment was to reduce the intraocular pressure or the eye pressure, and that is known to prevent the progression of glaucoma. We know that there are many risk factors of glaucoma, but the only way of treating the glaucoma at this point in time is to reduce the intraocular pressure. Now, this reduction in intraocular pressure can be achieved in many ways, in the form of medications, topical medications, in the form of lasers and surgeries. And depending on the evaluation by your glaucoma specialist as to what type of glaucoma you have and what stage of glaucoma you have, the treatment protocol is planned. Glaucoma is a chronic disease, and once diagnosed with glaucoma, the medications or the treatment is lifelong. We generally start the patients who have been newly diagnosed with glaucoma on topical anti-glaucoma medications. Using the topical medications is on a regular basis becomes a challenge. So there are many studies which have established that the adherence and compliance to medications after 2 or 3 months drops down drastically. So when the usage of medication drops down, the disease progresses without the patient knowing about it all by themselves, because glaucoma is a painless condition. The other aspect is the topical glaucoma medications comes with its own side effects, either in the form of ocular surface disorders, wherein the eye generally tends to be a little hyperemic or red. They tend to have dry eyes. Some patients develop intolerance to certain topical medications. So this need not necessarily be the case for all the patients who start on topical medications right away, but eventually over a period of few months to years, patients who are on topical anti-glaucoma medications start experiencing one of these features. The other aspect is the cost. So these glaucoma medications are quite expensive, and the prescription has to be refilled every monthly depending on the usage and the way the doctor has advised you to use it. So cost is another factor. On top of it, the fact that whenever the medications are missed, there is a chance of disease to progress. So generally what happens is, just before the patient comes for an evaluation for eye checkup to their glaucoma specialist, generally they are very particular about using the drops for the first 2-3 days, which is why when we measure the pressures on the day of evaluation, the pressures seem to be within normal limits. But what has happened before is that because of non-compliance, in the intervening period, the patient may have missed medications on multiple occasions. So this reflects on their evaluation in the form of a field test or the OCT test that we do as a part of a follow-up visit. It reflects in the form of progression of the disease as such. So these are the challenges when the patient begins their treatment with glaucoma on topical medications alone. Now, knowing that the laser for treatment is available and also now is increasingly being recommended as a first line of management, helps address all these challenges. So selective laser trabeculoplasty is a form of treatment wherein the fluid passage inside the eye is subjected to a light energy, and this light energy does not cause any thermal damage or any cutting or any deformation of the channels. It rejuvenates these natural fluid pathway in such a way that the natural fluid pathway enhances the outflow of the fluid from the eye. So this is the most physiological way of addressing the pathology in glaucoma. So this is a treatment which is done in the OPD, lasts about 5 to 10 minutes. A numbing drop is placed on the eye and a special lens is used and placed on the eye, and the laser process is completed. It's better that you take a day off after the laser, or you have somebody drive you back. After the laser is completed, your doctor will put you on certain topical medications and usually will check you again in a week's time, and depending on the response will call you back for a follow-up visit. The actual effect of this laser is evaluated at the end of 4 to 6 weeks. The immediate next day there will be no drop in your intraocular pressure. At the end of 4 to 6 weeks, the effect of this laser starts becoming obvious. The studies have shown 70% of these patients remain drop free for a period of 3 years. So the advantage here is freedom from using the drops. Their risk of developing cataract or their need for further surgical interventions for management of glaucoma has drastically come down. The treatment helps us to control the intraocular pressure and control the progression of glaucoma, but it does not treat glaucoma. Whether you choose to plan for a topical anti-glaucoma medications or whether you choose to go for selective laser trabeculoplasty, your treatment protocol of having a regular follow-up, check your intraocular pressure does not change, which means it's important to have a regular follow-up of your eye pressures every 4 to 6 months. It's also important to evaluate your optic nerve and the vision and all the other parameters that is part and parcel of your glaucoma follow-up visit. If you have been diagnosed newly with glaucoma, do discuss this option with your glaucoma specialist about other modalities of treatment as well, so that the benefit of these newer treatments pass on to you. This is not to suggest that anti-glaucoma medications should not be used. For some patients, in certain places where selective laser trabeculoplasty may not be available, anti-glaucoma medications are still the first go-to. So do discuss more about these options and ensure that you are aware about the pros and cons of both the modalities of management. So I hope this has made you understand about the other modalities of treatment in glaucoma. And if you have any queries, please reach out to your glaucoma specialist who will help you out.